High blood pressure is called the silent killer for a reason. After age 50, it becomes one of the strongest predictors of heart attack, stroke, kidney failure, and cognitive decline. The most dangerous part is that most people feel completely normal while their arteries are slowly being damaged. Blood pressure is simply the force your blood exerts against your artery walls. When that pressure stays elevated over time, it creates micro-injuries inside the vessels. Your body responds with inflammation and plaque formation. Over years, this leads to arterial stiffness, reduced elasticity, and increased cardiovascular risk after 50. The risk increases because of structural and hormonal changes. Arteries naturally become less flexible, estrogen and testosterone decline, insulin resistance becomes more common, visceral fat increases. All of these factors contribute to rising blood pressure. A normal blood pressure reading is generally below 120/80. Between 120 and 129 systolic is considered elevated. Once you reach 130/80 or higher, it is classified as hypertension. And the longer it stays elevated, the more cumulative damage occurs to the heart, brain, and kidneys. One of the biggest misconceptions is that high blood pressure only affects the heart. In reality, it directly impacts the brain. Chronic hypertension damages small blood vessels in the brain, increasing the risk of vascular dementia and cognitive impairment. It also significantly increases stroke risk. Both ischemic and hemorrhagic, there are warning signs. Although many people have none, persistent headaches, blurred vision, shortness of breath, chest tightness, fatigue, and nosebleeds can sometimes appear. But often the only way to know is to measure it regularly. Home blood pressure monitoring after 50 is not optional, it is preventive medicine. So what actually causes blood pressure to rise? The first major driver is insulin resistance. Elevated insulin levels cause sodium retention, increase sympathetic nervous system activity, and promote vascular stiffness. This is why high carbohydrate diets and metabolic syndrome are closely linked to hypertension. Second is chronic stress, when your body remains in fight or flight mode. Cortisol and adrenaline increase heart rate and constrict blood vessels over time. This stress pattern becomes baseline physiology. Third is excess sodium combined with low potassium intake. Sodium alone is not always the problem. The imbalance between sodium and potassium is often more important. Diets low in vegetables and high in processed foods create this imbalance. Fourth is poor sleep. Sleep apnea and fragmented sleep elevate blood pressure significantly. Many people treat hypertension without addressing sleep quality, which is a foundational driver. Fifth is inactivity. Regular movement improves endothelial function, increases nitric oxide production, and keeps arteries flexible. A sedentary lifestyle accelerates vascular aging. Now let's talk about how to lower it safely and effectively. Weight reduction is one of the most powerful interventions. Even modest weight loss can reduce systolic blood pressure by 5 to 10 points. Reducing visceral fat decreases inflammatory signaling and improves vascular compliance, strength. Training and moderate aerobic exercise improve nitric oxide availability, reduce insulin resistance, and improve arterial elasticity. Consistency matters more than intensity. Dietary adjustments are critical. Focus on whole foods rich in potassium, magnesium, and fiber. Reducing refined carbohydrates improves insulin sensitivity and lowers sympathetic activation. Magnesium supplementation may support vascular relaxation. Omega-3 fatty acids reduce inflammation and improve endothelial function. However, supplements should complement lifestyle, not replace it. Breathing techniques can also reduce blood pressure acutely. 5 to 10 minutes daily can have measurable effects. Sleep optimization is essential if you snore, wake unrefreshed, or feel daytime fatigue. Evaluate for sleep apnea. Treating apnea alone can dramatically reduce blood pressure in some individuals. Alcohol moderation is non-negotiable. Even moderate daily intake can raise blood pressure in susceptible individuals. For some people, medication is necessary and life-saving. There is no weakness in using antihypertensive medication when indicated. The goal is long-term. Organ protection, lifestyle optimization, and medication are not enemies, they are complementary. Tools. The key concept to understand is this: high blood pressure is not a number problem. It is a vascular aging problem, and after 50, protecting your arteries protects your heart, your brain, and your longevity. Measure it, monitor it, address the root causes. Build habits that improve vascular resilience instead of accelerating damage, because controlling blood pressure after 50 is not just about adding years to your life, it is about protecting the quality of those years.